Welcome to another episode of Plugged into Public Health. I'm Lauren Lavin, and today we're going to be diving into an inspiring conversation with Kassie Owens, a passionate public health advocate and Master's of Health Administration and Health Policy student at the University of Iowa. Kassie shares her unique journey that led her to explore health policy and management, highlighting her recent global health internship in Romania. Throughout this episode, we'll explore Kassie's work with the LGBTQ community, her research on healthcare systems abroad, and the lessons she's bringing back to the U.S. healthcare landscape. Get ready to hear about cultural exchanges, healthcare access, and Kassie's drive to make a positive impact on healthcare equity. Let's get plugged into public health. Hi, Kassie. Thank you so much for being on the podcast today. If you'd like to start off by introducing yourself and also telling us a little bit about how you ended up at the University of Iowa.
Yeah, absolutely. Thank you for having me. My name is Kassie Owens. I use she, they pronouns. I'm originally from Marion, Iowa, so right by Cedar Rapids.
Yeah.
And I started as a biology major at Coe College in Cedar Rapids.
Okay.
And I was pursuing pharmacy. So really wanted to be kind of a practitioner and get that experience in the medical sphere, I suppose. And as I was nearing the end of graduation, preparing for my PCAT, of course, we had the pandemic around my junior year, right? That kind of shifted a lot of my plans. I was thinking a lot more about what I wanted to do with my life. And a lot of that I found really wasn't for me. Being behind a counter all day, helping patients with medications. I really wanted to make more of a community impact as I was more politically involved in my undergraduate program than I had been previously. That kind of led me to finding the College of Public Health at University of Iowa and the Master of Health Administration. So I have finished my first year in that program and am going into my second year and recently added on the dual degree for MPH in policy.
Oh my God.
Yeah, I know it's a lot, but it really aligns with what I want to do. I came into this thinking like, oh, I could just work as like a hospital CEO or something and get more like on the ground professional experience so I could use that information for policy. I didn't know with health policy that you can just go into it. You can read, you can learn, you can help revise and edit policies. I really look forward to that sort of process, and I'm really glad to be here learning more.
You didn't come in knowing that you were going to do an MPH too. You added that upon learning about that option.
Yeah, I always talked about it in my graduate interviews, how I was interested in policy, politics, and every one of them asked me, like, why are you doing this dual degree? Or did you know that we have this?
Yeah.
And I would always explain it like, oh, I'm just getting the experience. But then I took health policy my first semester here, and I was like, oh, this is really valuable information. Yeah. Dr. Kassie has a lot of wisdom that he imparted on us, and I really loved that as challenging as it was.
Does adding on the MPH add on time to the institution? Okay.
Yeah, so I will be here for 3 years instead of 2, which is fine by me. I love it here. It gives me a little more time to breathe.
That's
happy with that.
totally true. Before you have to like make another big decision. I get that. Recently, though, you spent the summer in Romania, correct?
Yes.
Yeah. What kind of motivated you to pursue an internship in Romania this last summer?
For my internship with the Master of Health Administration program, I was really looking for an experience that was really new and different from what I am familiar with here in Iowa, as I have been around hospital areas pretty much my whole life. Cedar Rapids is a major metropolitan area with St. Luke's and Mercy Hospital, so I was a patient under those systems. And that's kind of what got me involved in healthcare in the first place, is having those institutions nearby. And of course, now living here in Iowa City, being near the University of Iowa and everything, I wanted to get out to another state, perhaps another country, to just see something completely different, make the
Yeah.
most of my experience here as a graduate student. So I really looked all over the place. I applied to a bunch of different programs all over the country. I originally was looking to pursue an internship in Japan, um, that is a partnership with the MHA program and a previous MHA graduate. So it's kind of offered every year to one
Yeah.
of the MHA students. And there was another student that was interested in that as well, my classmate Varun. I was looking for opportunities and I told my advisors that I told Dr. Wilson and Gwen that I was really stressed out and looking for anything that would work possibly. And Dr. Wilson very kindly offered me the opportunity of looking into Romania as my internship
Hmm.
opportunity. I looked into it more, and Sophie Switzer got me connected with one of the advisors there at Babeș University at the Cluj School of Public Health, and her name's Roxy. She's super cool. I talked a bit with her. I got more familiar with Romania. I looked up a lot because I had no idea. I had never
Yeah,
seen
I'm a
of Romania.
preparer too, especially when I'm traveling. I like to know all of the things before I show up.
Yeah, yeah, absolutely. I wrote up my interest statement and everything, and they were really excited to bring me on. I was
That's
just
great.
excited to get a completely different new experience that I never would have thought.
Yeah. I I think people think that, and while the US healthcare system is really an N of one, going to other places, you don't know how to what new ideas are out there, even if they may not be like directly translatable, you can still gather new ideas that you can bring back here and apply
Yes,
in its own way. So I think
definitely.
that's great. We become better US citizens when we see more of the world. Can you tell us a little bit about the program that you did over the summer?
Yeah, so what they call it through the Cluj School of Public Health is the Global Health Internship. So it's really a broad program, and there were a bunch of options that they offered with the basically informational packet that they sent me. There's different opportunities through research, rural health focus, medical focus. It's a really broad spectrum of things that you can do, and I appreciated that. And the section of the program that I wanted to most focus on was their community health program. So in that program, what that entailed is kind of finding different nonprofits in the area that I could work with and have some sort of community focus. I was most passionate about and have been passionate about for a lot of my career as a student is the LGBTQ community, as I am
Mhm.
a member of the lovely community we have. And in Romania, it's an Orthodox Christian country. So compared to a lot of other European Union countries, there are more stigmas, a lot less rights for LGBTQ people. So I really wanted to look more into that and what their community is doing now to kind of cope with that or any sort of activism they're doing, and how that pertains to healthcare as well, specifically issues that a lot of the world is talking about right now with gender affirming care, surgery, hormones, reproductive care, any sort of things that are tangentially related to that.
Mhm.
So I worked with some advisors with the Cluj School of Public Health, several really smart, amazing people, different professors, people that had taught at the college for a long time, and they were able to connect me with a local nonprofit called the Queer Sisterhood of Cluj.
Hmm.
So I worked directly with the head of that organization, Ruth, and she is lovely. She talked to me a lot about the history of different LGBTQ issues in Romania and how they dealt with that discrimination over time. We made a plan to really start with a found health promotion sort of campaign. I started off brainstorming, kind of wanted to do some sort of flyer that we would hand out, but we ultimately came to the conclusion that it would be easier to do and also easier to get to a bunch of people to do more of a social media campaign. I'm working with their Instagram to eventually, I'm still working on it, but posting some stories and posts that talk about LGBTQ health in Romania, some basic vocabulary, different stories from people, or I did a lot of interviewing. So, of different people in the community of Romania and using that information in a way that helped advertise those issues and normalize those issues so that more people are aware of it, especially medical providers. So, a lot of healthcare for LGBTQ people, even in the US, is or lackluster, missing a lot of empathy, missing a lot of, yeah, just having that experience or knowledge, really.
Yeah.
I'm still kind of finishing up on that.
Hmm.
And a side project I worked on to complete more of my Cs for the MHA program is a stakeholder project, different stakeholders in Romanian healthcare, and doing an analysis of that. I completed a bunch more interviews with different professionals in different areas of healthcare, hospital managers, practitioners, public and private practice leaders, just a bunch of different people, educators. And I put together a presentation on that and presented it to a couple of my advisors that were there since a lot of people were gone for the summer. Unfortunately, the college was pretty empty.
Yeah.
Um, but they told me that I presented it well, and I'm glad that I was able to summarize that information in a way that was understandable to them who had
Right.
lived the experience
Hmm.
and hopefully also understandable to people in the US as well. So I can take that presentation and share it with other people as well.
It sounds like you had a really busy summer and you were doing some pretty cool projects. One of my follow up questions to that, given your identity, were you nervous about going to Romania, or was that not something that you kind of even considered prior to going?
Yeah, I wasn't sure how I would interact with the community there.
Mhm.
I'm generally fairly familiar with more rural areas, especially being from Iowa, people that aren't necessarily as accepting of my identity.
Yeah.
So I had a little bit more confidence than maybe some other people in more liberal bubbles, as I would say,
Yeah.
that have a lot of people that accept them since I
That makes sense.
was more familiar with people that
Yeah.
don't necessarily. But going anywhere with a different culture and not knowing how they will respond to you as an American is kind of scary.
That's totally fair. So you kind of referenced how you did these interviews, but do you want to maybe expand on that? Or how did you involve like the local community and researchers in your work?
Yeah, I started with interview questions. I did a lot of research and
Hmm.
background into Romanian healthcare and the LGBTQ community as well, and had those interview questions reviewed by my advisors and Ruth with the Queer Sisterhood to get them to review, look over, make any suggestions since they have more knowledge as Romanians. They responded very well to my questions. I have a little bit of a background in journalism. I'm a little bit familiar with interviewing, and I think that helped a lot when I was trying to put together those questions.
Yeah, absolutely. How do you think that some of the lessons that you learned from your work in Romania apply to either other places in the world or the US?
Healthcare is a huge thing that affects all of us, which is one of the most interesting things about it and why I want to continue to work on it, since it is so applicable everywhere. Everyone needs and knows healthcare. With Romanian healthcare, I think a lot of similar issues to US healthcare arose as I was interviewing and talking to people, even other students in the area that had experience directly with Romanian healthcare.
Mhm.
Um, a lot of issues with staffing, I think, has been a huge thing worldwide. Issues with funding, which arose differently, I would say, than funding issues in the US, since Romania started with a communist system
Mm.
from about the 40s, like 1945-ish to 1989. It was kind of a brief period of time, but it was a very foundational time in their
Yeah.
society. And they built a lot of healthcare institutions around that.
Mhm.
So there's a lot of hospitals and things that were built on public funding. And they do still have the social health care insurance system that is very centralized. They're not under the communist rule anymore. It's a little more different now, but a lot of their infrastructure has not been updated in a long time since
Yeah,
it
that
was
makes
all,
sense.
yeah, it was established at that time and they didn't really anticipate much growth. The social health insurance system doesn't necessarily fund a lot of the needs that they have. As I was talking to providers and health managers, they talked about how different treatments for patients still have greater financial needs than social health insurance can allow. They have to kind of make up for that from the institution itself, which really hurts their margins. And they're looking into broadening into more private institutions since that's a completely new arena for them within the last like 30, 40 years. As they're branching out into more private institutions, I think that might help a little bit in diversifying funds, but also just noting that the experiences in healthcare management and public health are applicable to anywhere in the world, really.
Yeah.
It's a similar experience with anyone in healthcare leadership and anyone trying to make decisions for budgeting healthcare for the community, things like that.
The budgeting portion of that is something that everyone can relate to. There never seems to be enough money or workers or even time in the healthcare system. I'm guessing that
Yes,
that is not unique to the US.
definitely not. Yeah.
Looking forward then, what are some of your hopes for healthcare access and equity? You can either talk about this in the Romanian lens or in the US lens or both.
Working with a totally different healthcare system in Romania helped me conceptualize what I think could improve with US healthcare and vice versa, what they could improve with Romanian healthcare, since,
Yeah.
of course, we can always improve with any
Exactly.
system we have. But that systemic improvement is something I'm very passionate about and want to focus on in my career as I'm potentially working on policy or working with other healthcare leaders in government, within nonprofits or other institutions, working towards improving systems and having policies that better help the community as a whole and don't necessarily just help certain institutions, particularly like for profit institutions, as money in healthcare is such a major issue in the US and everything is so expensive. And that's part of what inspired me to go into healthcare management, healthcare policy, and what I want to continue to think about through my career as my main inspiration for whatever I'm going through. And obviously, with helping affordability in healthcare, that will then help access and equity, which could highly improve in the US and could improve in Romania as well. They also talked about how a lot of their rural communities don't have that access
Mm-hmm.
for healthcare. And we have a lot of the same struggles here in Iowa as well, with so many critical access hospitals and other things. I think having that experience of seeing another system that also has those same issues and seeing how they address it maybe a little bit differently will be helpful in my future career. Yeah.
That's great. Then, what are some of the key takeaways from your time in Romania, either personally or professionally?
Yeah, that is a great question. I would say personally, one of the key takeaways that will stay with me is that we're not all that different all over the world. I also met with some Nigerian students
Mhm.
that go to Boya University, and they had a very different perspective on being in Romania. And perspectives like that really matter wherever you go in healthcare.
Absolutely.
That is one thing that I would take away for sure. I guess the next thing I would take away is that any sort of diversity is positive for the community. And I've known this for a while, but especially being exposed to different cultures as far as language goes
Yeah.
and having a language barrier for myself, whereas I'm used to it being the other way around,
Right.
coming from the US where English is the main language, and in Romania, English is very much a secondary language. Having more accessibility for language in healthcare, I think, is something that would be important to work on in the future.
I think that's a
Um,
really important takeaway too. We're pretty privileged as like English speaking Americans that kind of wherever we go, English exists or is kind of the secondary language. I can't imagine even just traveling like for like pleasure purposes if you didn't have any sort of common, if your just language was so uncommon that you couldn't even communicate in a new place. That would be really difficult. It becomes even more dire of a situation when you're trying to communicate something like a healthcare need that is
yeah.
time sensitive. So, yeah.
Yeah, and that sort of getting out of my comfort zone leads me to my final takeaway, which would be just try different things.
Yeah.
Try new things. I've done that really my whole life. I am always one to jump into new opportunities and really take action in what I'm passionate about. Having this experience in Romania really cemented that for me, that just going for something that you care about, even if it seems a bit more scary or something that might be very intimidating, people aren't that different from you. So you belong. Like, I feel like I can make belonging for myself as a leader. And to any other leaders, I would also say that is that you can make a place where you belong. And yeah, that's one of the best takeaways I have, I think.
I love it. Do you have any advice for students who would want to pursue a summer abroad opportunity?
Yeah, I would say be prepared for anything weather-wise because it was the hottest summer in Romania to date,
Oh my
as
god.
we have had around the world
Yeah.
very hot summers, and they don't have a lot of the infrastructure for air conditioning.
Mhm.
So I bought a little hand fan, and that was really my go-to, just having that hand fan. I would also recommend making connections wherever you're going because you might just only have a connection with the director or whoever you're communicating with when you apply to a program. But having more people in your host country, wherever you're going, to work with, if you're working with the community or working with other students, maybe other practitioners,
Mhm.
anyone really, just having those connections established ahead of time really helps save you fear of being in a new place saves you time in like introducing yourself to a lot of people. I know I had to introduce myself to a lot of different people. And yeah, for the purpose of my project, having more contacts ahead of time would have helped me in getting started with it sooner and maybe scheduling interviews ahead of time as well. For advice, I would say look into funding opportunities, any sort of financial assistance, because this internship that I did is unpaid. And it's very important for me to express that to other people, as not everyone has the same opportunities financially. I was able to get a funding grant through the university, but I wish I had looked into other funding opportunities because I know there are so many, not only through the university, but otherwise you can find more funding. That's always a good idea for traveling, is to have a budget and to have extra funds to work with.
Absolutely. That's a great final piece of advice. Thank you so much for coming on the podcast today. You provided a lot of really great information that I'm hoping that our listeners found useful as well.
Yeah, thank you for having me.
Thank you for joining us on today's episode of Plugged Into Public Health. It's been a pleasure hearing from Kassie Owens about her incredible journey from Iowa to Romania and the valuable insights she's gained along the way. Kassie's passion for healthcare equity and her commitment to community impact is truly inspiring. If you enjoyed today's episode, please don't forget to subscribe and share it with your friends and colleagues. You can learn more about the University of Iowa College of Public Health on Facebook. Our podcast is available on Spotify, Apple Podcasts, and SoundCloud. This episode was hosted and written by Lauren Lavin and edited and produced by Lauren Lavin. Have a suggestion for our team? You can reach us at cph-gradambassador@uiowa.edu. This episode was brought to you by the University of Iowa College of Public Health. Until next week, stay healthy, stay curious,